Episode 6. You're about to see a small compilation of videos that I put together, well, with the help of Amy, that we put together, just showing you the beginning of my chemotherapy. I know in some of the other videos, I wasn't thinking, that I would have to do chemotherapy because I did a double mastectomy, but, here we are. So, in this day and time, with the videos that you're about to see, I'm beginning chemo and I'm just explaining, I'm showing you the room, I'm showing you the nurses and, everything that they're saying to me. Because I know that going into this, there were a lot of things that I didn't know. So I'm going into detail about the symptoms, side effects, and I wound up doing 8 rounds of chemo. And that's where we are. Thank you for watching. Any questions, comments, just DM me. I welcome them all. Thank you for watching.
Initially, since I did both breasts, I was thinking that I probably wouldn't have to do like chemo or radiation, or it would, limit my chances of having to do that. But no, I saw the oncologist today, and for the first time, and she's saying she would want me to at least take the pill, the chemotherapy pill, for probably a couple of years. What they're doing is they're taking the cancer, the tumor, and send it to, I think, this lab or a place where they analyze. The way she described it was they're going to find out the characteristics of the tumor, or what all is involved in the type of cancer that was in my left breast. And then they'll be able to better let me know whether or not I'll have to take the pill every day, or do a shot every 3 months and the pill. So, because the way they described it was the type of cancer I have is it feeds off of estrogen. So they would have to give me something to turn my estrogen off so that nothing else develops. So we'll see. I'm feeling good. Feeling great, actually. Just ate. I'm home. Good spirits. Always. About to take a nap. So, it's now about, 3 o'clock. I've been here since 7:45. I came in to get my labs drawn. My normal. I did my COVID test yesterday. Today, got my labs drawn this morning, and then then I had to see the doctor, and then they wanted to do a biopsy again on the left side. So when I came last week, they were supposed to do the sonogram and the biopsy at the same time, but it's cute. They wanted to do the same. They wanted to do it at the same time, but they had me waiting. And I've had this discussion with the imaging department, had me waiting, so I only had time for them to do the sonogram. And I had to come back today for them to do a biopsy. So they did another sonogram, biopsy. There's 2, that same lymph nodes that's there. They put a marker in it. What else? And then they saw something else. They saw what they think is probably just scar tissue from my surgery. They're thinking it's just scar tissue. I don't know. I'm just really loving this hair. This is I love it. It takes 2 days to get the biopsy results back. But the doctor that was there was pretty much, this thing is crazy. Pretty much, the doctor and the technician, they both were figuring that they were just radioactive. Was just showing up as radioactive, meaning just remnants from the surgery. And she wants me to have the surgery where they're going to remove all of the lymph nodes over here. And I'm still completely against that. And I'll say it again. They want me to remove all the lymph nodes in my left arm, which will make it highly likely that I'll develop lymphadenopathy. So I'm just against it. So what I want to do is, I want to finish the chemo, go for the consultation for the radiation, and then do a bunch of scans and see if there's anything left. I think we should determine at that point in time whether or not it's really absolutely necessary that I need the surgery. That's what makes sense to me, and that's what I'm gonna do. So I have about another hour here.
This is what's gonna happen. Told you guys before, little mix up at. They still don't know if that lymph node in there is cancerous, or a couple of lymph nodes are cancerous. My new doctor me up with all these other tests. All right, now you're up to date. But I'm going to be doing, instead of doing the 4 rounds of chemo, I'm doing 8. So she switched that. So 2 rounds of 4, one every 2 weeks, for 8 rounds. I'm gonna have to take steroids. They're telling me that might do certain things to my body. The other day I got an axillary sonogram, so they did like a sonogram just to try to see if any of my lymph nodes looked weird. This coming Monday, I was supposed to start chemo, but I can't because they have to do a PET scan. They need to do a PET scan to see where or if any cancer will be highlighted from the PET scan. So I'm doing that on Monday, and I start chemo Tuesday. So that's gonna be my first actual, chemo. I still feel great. I mean, I decided to do this video kind of spur of the moment, so I'm looking at myself right now like, oh my god. But yeah, no, I'm still, still in great spirits. I still would have the same mindset, like, let's get this shit started to get this shit the fuck over with, please. I'm here getting my PET scan done. Right, and then there's like that machine, and then this is like it's like this radioactive contrast that's being injected. It's gonna make me radioactive. I have to do a diary. And then Leah here gave me this delicious drink, this chalky mixture. You see that? Yeah, yummy. And then like the joke of the day is you're hungry anyway, so it might not taste that bad.
Alrighty. Stay safe.
Thank you.
You're welcome.
Ugh.
And then if you need the bathroom anytime, just come out this door and then they go right.
Okay, thank you. So I have to sit in here for gotta keep this on, I know. This, since the contrast is now injected in me, I have to wait 45 minutes, and then they're gonna bring me into a room where they're gonna do the scan. Yep. I'm just watching Wendy. My girl, I haven't seen her show in so long. Wendy Williams. Either you love her, you hate her, and I love her. So, I am sitting here getting my first treatment, and there are some things I did not know. Alright, so some of the rest. Fever, shaking, chills, unusual bleeding, bruising, diarrhea, vomiting, difficulty eating, drinking, swallowing. Y'all know I gained like 15 pounds already, so that's okay. Extreme fatigue, pretty active. I don't think that's gonna. Numbness, tingling, painful bone urination, soreness or redness in the intravenous site. This is pretty good. This is a good one. She did a pretty good job. Yeah, all of these things, like, I have no problem with any of these things. There was one thing on here. No, that's what it was. They say that I'm going to have a decreased sexual appetite and decreased vaginal, I guess, lubrication. Y'all will be the first to know. That's definitely something I'm going to document, because I cannot imagine that, and like the difference in like my taste. Like, they're saying that my taste buds are going to be, well, could possibly be a little compromised, but I don't know. We'll see. Okay, 1 down, 7 more to go. I don't know if I said this in the previous video, but my white blood cell count was a little bit low.
So there's something called Neulasta that I need to have injected 27 hours after my chemo. So they know that I've been back and forth all week. So basically they're gonna give me this. It's like an adhesive. They stick it to me, and it after 3 minutes after it's on, it pokes me, right? Just to make sure that the needle was in. She checked it. There's like a green light that flashes on top. Technology's man. And so tomorrow, around 8 something, it's gonna inject 8 something in the evening. It's gonna inject the Neulasta into me, and then that injection is a slow injection. It takes about 45 minutes. The light's gonna go. It's gonna stop flashing green. It's gonna stay on green. And then that's okay. Then it's okay for me to rip it off. So every time I have my chemo, I have to do all of these things except the Lupron shot. The Lupron shot is every other chemo. So 1 down, 7 to go. I have all of my meds. She went over it with me a few times. So I'm taking a steroid. They have me taking Claritin every day. I have to take Prilosec every day. My iron was low. I've always been anemic, so I have to take some ferrous sulfate every day. It's so weird for me because I've never been on medication before. Like the last medication I was on was like birth control when I was like in my 20s. Like, was I even in my 20s? Yeah, like early 20s. So yeah, this is very weird for me. Very, very weird for me. But as you can see, I just came home from my treatment and I'm extra excited. I want to dance around and eat and just wait for the weekend to see what side effects I'm actually going to feel. But right now I feel great. Oh, so this nurse, I forgot to tell you, this nurse did not know me. This wasn't my regular doctor's nurse. This is someone that didn't even know me. After we're talking for about an hour, she's like, you seem like you have a lot of energy, like you're real high energy, you're really active. And I'm like, oh yeah, I'm really active. I said, but I've slowed down a lot, a whole lot, Pandemic, a little bit of cancer, slow me down. She's like, well, you have to take it easy. And I'm like thinking to myself, this lady don't even know me, and she's telling me how to take it easy. But no, I told her, I was like, yes, I understand, I'm limiting my work. I'm like, I've definitely slowed down, but I thought it was kind of weird that someone that's never met me before was on some, you guys take it easy. And I am. I'm listening to the doctor. I'm listening to my body. I'm going to do some more yoga today. I did it this morning. We did it this morning. So, yeah. So, wait to see how I feel. This is the 5th day after chemo. 6th day after chemo. After the first treatment. I would say, okay, so first and foremost, I have not had a glass of wine since the day of chemo, which is like, ah! But yeah, you're not supposed to drink wine. They told me that you're not supposed to because it definitely dehydrates you. I'm actually doing okay. I would say the biggest side effect that I've had is definitely the dehydration. I feel really dehydrated. And then the nausea. The nausea is controllable to a certain extent. I don't know if it's because it's kind of hot. Because when I'm in the back office and I'm in the cold air, I feel a lot better. Could be a combination of the two. The nausea and it being kind of, me being dehydrated. But I've been drinking so much water. Like crazy water. And then my new concoction is ginger ale with vitamin water, or ginger ale with vitamin water, or ginger ale with Gatorade. Like I mix it up with lots of ice. If it's like ice cold, like I'm literally about to leave the bathroom and go do that right now. Like mix my little concoction up. Other than that, I'm good. I have my next treatment for today's Tuesday. For next Tuesday, actually, a week from today. So, we'll see. Denise just asked me some really important questions that you guys should hear.
I was asking if she's having any symptoms such as diarrhea, constipation, numbness and tingling in the hands and feet, or mouth sores, dryness in her mouth, any kind of discomfort.
These are all side effects of the type of chemo that I'm getting.
Yep.
So those are questions that are probably going to be asked of me every time that I'm here.
That's right.
And
every time.
Yep. My answer was that you, for the most part, just nausea. For me personally, for my personal experience, I've just had nausea, and it's for the most part been controlled. So.
And it didn't last long, you said, right?
Yeah, the worst. It's kind of like something that's like always there. Like you feel it, it's still there, but it's just not there.
This is like the juiciest one.
That's okay. They had to do that for my surgery.
Hidden treasure. I'm looking up here.
She's looking for veins. That's what she means. Just in case you guys are like, what is she talking about? She found a good vein.
We
in
get
my hand
excited
right there.
when we see these juicy ones.
That's a real nurse right there. She's excited about a juicy vein.
Are you ready?
Yeah, I'm ready.
Okay. But I was just letting her know she's going to go up for her follow-up exam with the doctor. In the meantime, her lab work will be resulting. And then if all is well, I'll release her chemo. Pharmacy will mix it. And then by the time you come downstairs and your appointment is over with the doctor, we can get started.
Yes. So you guys understand that everyone's chemo is different. They mix your chemo according to your labs. So she's taking my labs right now. This is the blood work. And then they mix it, which takes about 45 minutes or so, right?
About an hour.
About an
maybe.
hour.
Less than, yeah, hopefully.
They mix it, and this, what is it called? It's like, not injection, but it's IV.
Infusion, yeah.
The infusion. So the IV that she's starting right now is the only one I'm gonna need to get. So for the so she doesn't have to stick me anymore. It's literally just this. And she's gonna tape it up so it's nice and cute and comfortable. I can walk upstairs with it. Hey. So, R.I.P. Pop Smoke. Today is Wednesday. I did my second treatment yesterday. So that's 2 down, 6 to go. I still feel good. Yesterday was a little harder. I was told that my treatments were like after the first treatment, like however my body felt in the days after the first treatment, that is what my body would be like for almost every treatment, at least for the first 4 cycles of chemo before I go into the T portion, which I'll explain later. But I remember today is the second day after the second treatment, and I could not sleep last night. I did not sleep. I only slept a couple of hours, and it could be for a few things. I mean, I did have a little bit of anxiety going in after they took my blood work and stuff. I told my doctor, and I was telling her, like, you know, I'm not really sure where it's coming from. I've had that issue kind of off and on. She's like, she wants to prescribe me, was it Ambien? Yeah, I think she wants to prescribe me Ambien. Okay, so this, I know you're like, what the hell is that? So my best friend, after Cookie, showed us that she does the home kit for the gel and stuff. She gave me, my best friend Melissa brought me one of these, so I don't think I'm ever going back to get my nails in again. This quarantine has been really crazy for me in some instances, but this is probably one of the best inventions. This home gel polish thing is just amazing. So I have to go to work today, so I'm trying to get this done before I go to work. But this is not the case. So the day after the first treatment, I felt okay. I think I did a video about that, and I was really, really nauseous yesterday. I took all the medications as I was supposed to. They gave me a loading dose of the antiemetic in my IV. So I'm not really sure what's going on. I still have I haven't drank any alcohol, which is torture in itself. Having gotten 2 sessions under my belt, I'm extremely happy. I'm extremely grateful. This is definitely something I know I can conquer. I don't, I'm going through this situation right now as we're all going through the pandemic, so I can only gauge my situation according to like what's going on now. But in the hospitals, you still can't, like, no one can go in with you. There are, like, where I go is a breast center. It's only breasts. They only deal with breast cancer patients for the majority, but they also deal with breast cancer, metastatic breast cancer patients. So if the cancer started in the breast and it has traveled someplace else, they still treat those patients. So I see, when I go in for chemo, I see very, very sick people. Not many because we have the social distancing, but I do see very sick people. Everyone's very friendly. But everyone that goes there isn't getting the same type of chemo that I'm getting. I almost forgot about my Neulasta. So for the first 28 hours or 29 hours after my treatment is complete, they give me Neulasta, which is here. Right? I don't know if you guys can see it. I did a video about it before. It's something that you have to be really careful when you're showering. It's stuck to you. They placed it yesterday when I had my treatment. So today, I think 27 hours after, it gives me it gives me a prick when they first put it on. But it starts to slowly inject today. Probably around, so I finished the chemo like around 1 or 2. So it's like around 3. Like around 3 today. Like around 3 today, it'll slowly inject, and then I can take it off 1 to 2 hours after. So what it does is, when they initially gave it to me, because I remember when they did my blood work, they were saying initially that they had put my chemo off because my white blood cells were sort of low. So I thought that I was just getting that because of it, but no. Now I know that all patients that get the same type of chemo that I'm getting, pretty much get the Neulasta because they want to just make sure, even if your white blood cells aren't low, they want to make sure that they don't fall low because they want your body to still be able to fight the breakdown that the chemo is doing to your systems. And you know what? When they weighed me yesterday, I thought I had the quarantine 15 going on. But no, it's actually the steroid 15. that dexamethasone. Ever since I started taking that, I've gained probably about an extra 5 pounds. So COVID, because of the quarantine, I probably gained, 7 pounds, which is my weight goes up and down anyway. But this extra 5 to 7 more pounds is a little extra, but I kind of like it. And when it's gone, I'm gonna miss it because come October, I'm not gonna be on the steroids anymore, and I'm gonna still be working out. So yeah, I said it before and I say it again. I mean, the most important thing I think for me with dealing with this physically and mentally is just making sure that I have a very, very good headspace all the time. Making sure that I try to stay focused on keeping my life as normal as possible. I have had to make drastic changes because of this. I've had to make drastic changes in who I'm interacting with. Because I want to turn this off because I want you guys to clearly hear me. Because of COVID, I can't interact with 99% of the people I used to interact with. So even some of my closest friends, I can't see. So my immune system is considerably compromised. And even though I take the COVID test, and I'm consistently negative, I mean, they haven't tested me for any antibodies or anything. So even if they did, I can't afford to do that. So I can just go on about my day. 2 down, 6 to go.
First and foremost, I want to thank the Peterson family. This is my sister Pepe. Thank you so much for just tolerating me and having to see me go through this in your own personal space. Thank you so much to everyone that has commented, has showed me so much love. Thank you to the women that have shared their stories and experiences with me. I'm going to do a separate video about that. It's been amazing, the amount of love and the amount of sharing of this personal experience that I've gotten. Thank you so much to Amy. Thank you to Kenny. Shout out to Kenny for his for this dope sweatshirt. What lip am I wearing, you say? Oh. This is Oral Fix Beauty. You can check that out, www.oralfixbeauty.com. Check out all the colors and let me know what you think. But in all seriousness, thank you so much for your support and love. And we'll see you next episode.